everyone, welcome back to the Tox Lab. I'm Rebecca.
I'm Rob. This week we're going to be looking at the world of pet poisons, things that can cause harm to our furry friends. This came up because I was chatting to a friend of mine who asked me why chocolate is famously poisonous to dogs, and then proceeded to tell us about their dog that ate, was it 6 mince pies?
Yeah, I think so.
And a whole Christmas pudding. Might have been half a Christmas pudding, and then the rest of the Christmas pudding was served up to guests at Christmas. There was quite a lot going on. So shout out to Teddy, legend of a dog, one of our listeners. But famously, chocolate is poisonous to dogs, and we thought we'd look at that and a few other things that are poisonous to our furry friends and see if we can't unravel some of the mysteries.
Before we jump into today's episode, if you want to stay up to date with our content and when new episodes get released, you can find us on Instagram at _tox_lab. We also have a LinkedIn page. And for those of you who want to get in touch and suggest any content for any future episodes, you can also email us at thetoxlab@gmail.com.
So Rebecca, what's first? Chocolate?
Yeah.
So chocolate, poisonous to dogs. Mm-hmm. It's the theobromine in chocolate, isn't it?
Yes.
So a compound similar to caffeine, found in chocolate, has fairly mild effects in humans, but most dogs can't metabolize it, and so it accumulates and can cause toxicity symptoms similar to caffeine toxicity.
Mm-hmm. So while the half-life of theobromine in humans is about 2 to 3 hours, the absorption in dogs is a lot slower, and the half-life is about 18 hours. So you've got more of a chance of building up theobromine and then causing toxicity. So signs of chocolate poisoning in dogs can develop within 6 to 12 hours of ingestion, and symptoms can include polydipsia, so an increase in thirst, vomiting, diarrhea, abdominal distension, and restlessness. Hyperactivity, ataxia, tremors and seizures can also occur, along with cardiac symptoms like tachycardia, hypertension. Dogs can also exhibit hypothermia. And death due to theobromine toxicity or chocolate ingestion in dogs generally occurs due to cardiac arrhythmias, hypothermia, or respiratory failure. And when looking at the lethal dose of theobromine in dogs, it's about 100 to 500 milligrams per kilo of body weight. So to put that into context, plain chocolate and cocoa powder contain about 15 milligrams to 20 milligrams per gram of theobromine, whereas milk chocolate only contains 2 milligrams per gram. So a 10 kilo dog would only need to ingest 100 grams of plain chocolate to ingest enough theobromine to be fatal.
I think it's quite unpredictable, isn't it, chocolate toxicity in dogs? And I think part of the reason is the fact that there's so much variation in size between a Chihuahua compared to a Rottweiler.
Yeah.
I think some breeds are possibly more susceptible than others as well. I'm not sure it's been very well researched, but we've certainly heard stories of some dogs eating huge amounts of chocolate and not actually getting that unwell. Similarly, animals eating relatively low amounts, getting quite poorly. So I think there probably is quite a lot of variation between breeds too.
What's also interesting is cats can also be affected by theobromine toxicity, and their toxic dose is a lot lower than for dogs. But because they can't taste the sweetness in chocolate, a lot of cats don't go for it.
And I guess that's another factor that might make some dogs more susceptible. Some dogs will just literally eat anything, right? As I said, our friend's dog that ate the mince pies and the Christmas pudding.
So treatment options kind of depend on how soon after ingestion a dog is found. So you can induce vomiting. Activated charcoal is a popular remedy for a lot of different poisons. It's very non-specific. But this can cause a hyponatremia, so a raised sodium. So it's important to make sure the benefits of using activated charcoal outweigh the risks. Diazepam can be given if a dog is experiencing seizures, and fluid therapy is another option.
So pretty much how we treat human poisons.
Yeah, pretty much. So on the topic of mince pies and Christmas puddings that you were mentioning earlier, did you know that grapes and raisins are poisonous to dogs?
I did not know that.
So all members of the Vitis genus family, which includes grapes, raisins and xanthi-currants, are toxic to dogs. It's not completely understood what is in raisins and currants that causes toxicity. They think that tartaric acid might be to blame, as this is present at quite high concentrations, and dogs struggle to excrete organic acids because they lack organic acid transporters, and so tartaric acid can build up in the proximal renal tubular cells, and this can lead to renal failure.
I wonder if this is possibly also breed dependent, because I mean, Teddy eating all those mince pies, that's more mince pies than I could eat in one sitting.
Apparently more than one grape or raisin per 4.5 kilos of body weight is enough to cause toxicity in certain dogs.
More than one?
More than one. It wasn't very specific as to how many more than one, but the symptoms of toxicity usually develop within 6 to 12 hours, and vomiting or diarrhea is a common presenting symptom. Dogs can then experience lethargy, anorexia, abdo pain, weakness, dehydration and tremors. And then you get anuric or oligouric renal failure developing, and you can monitor this by measuring their creatinine, and that will rise disproportionately to urea. And treatment for this is very non-specific. GI decontamination is recommended, or IV fluid therapy.
I guess ultimately you could dialyse, but I'm not sure people ever dialyse dogs. They probably do if they've got the money.
I think they do, because you get cats that go through dialysis. So I imagine that you'd also get dogs undergoing dialysis too.
So chocolate and raisins are bad. Cadbury's fruit and nut, therefore, probably really bad.
Probably.
What else have we got? What else is poisonous to our furry friends?
So the next poison I want to talk about is xylitol, which is a sugar alcohol, and it's often used to sweeten sugar-free products, including gum, candies, mint, baked goods. But it's also found in a lot of non-food products, such as hair care, supplements, sun cream, toothpaste, and even some deodorants. So in dogs, xylitol stimulates a rapid dose-dependent release of insulin that can result in a really profound hypoglycemia, so really low blood sugar. And you can also get hepatocellular damage that develops as well. And this is thought to be possibly from depletion of ATP or the production of reactive oxygen species as a result of its metabolism. And more than 100 milligrams per kilogram of xylitol are associated with hypoglycemia, and greater than 500 milligrams per kilogram are associated with severe hepatic insufficiency or failure. And these signs can develop within 30 minutes of ingestion, but can be delayed by 12 to 18 hours if what they're ingesting kind of slows its absorption. So if they're eating like gum, for example, you're not going to get that xylitol being released and metabolized. And hypoglycemia can cause a variety of symptoms, including vomiting, weakness, ataxia, lethargy, seizures, and comas. Liver enzymes typically elevate within 4 to 12 hours after ingestion, but clinical signs of liver injury might not develop for a day or two.
It's quite an interesting effect, isn't it, on dogs' pancreases? Interestingly, it doesn't cause the same effect in humans. It's as if dogs' glucose sensors respond to xylitol, whereas human ones don't, hence why xylitol's found use in diabetic sweets and things like that. In terms of the dose in things like chewing gum, I think it can be quite high, can't it? Up to sort of a gram or so of xylitol in a piece of chewing gum. So it's not like it's in very low concentrations.
Yeah, I don't think they need to eat a lot to potentially experience these quite dramatic effects. But what was interesting is not all dogs who end up with a liver injury will get that hypoglycemia. Some of them will get a rebound raise in glucose, which you can sometimes see in humans when they overdose on insulin, for example.
Okay, interesting. So don't give your pets chewing gum.
Basically.
Obviously.
And treatments, again, are very generic. Early GI decontamination may be useful, but they don't recommend using activated charcoal in instances of xylitol poisoning and administering IV dextrose to correct any sort of hypoglycemia.
We focused a lot on things that are poisonous to dogs. How about things that are poisonous to cats?
So did you know that alliums are toxic to cats? So this includes garlic, onions, chives and leeks.
I didn't know what an allium was until you told me that.
So it's the sulfur-containing oxidants within alliums that are toxic to cats. And toxicosis can occur after ingesting less than a teaspoon of cooked onions or 5 grams per kilo of raw onions. And it does also affect dogs, but dogs need to eat a lot more to experience the same effects, so between 15 and 30 grams per kilogram. And these sulfur-containing oxidants can lead to hemolysis, cause oxidative damage to red blood cells. You get Heinz body formation and methemoglobinemia. And this can begin 24 hours after ingestion, peaking at around 72 hours. And it's quite hard to spot. So cats will normally present when the symptoms of hemolysis become substantial. So when they're experiencing a really profound anemia from it and experience things like lethargy, anorexia, fast breathing, tachycardia, weakness, exercise intolerance. But this can have quite serious consequences and can be fatal.
I had no idea they were that poisonous to cats.
I didn't either until I started researching for this episode. And so again, treatments like GI decontamination, which seems to be a classic one, Cats can also be given O2 supplementation or blood transfusions in really severe cases to correct this. And of course, supportive therapies like IV fluid therapy.
So what else is poisonous to cats? I know there's at least one thing, which I think you might be about to mention, essential oils.
Yes, that is what we're talking about next. So some essential oils are toxic to cats because they lack the enzyme glucuronide transferase, which is needed to metabolize phenols and phenolic compounds, which are found in some of these essential oils. They can be rapidly absorbed through the GI tract, skin, through the airways. And cats are also quite sensitive because of their grooming behaviours. So if they get essential oils on their fur and as they start cleaning themselves, they then risk dermal and oral exposure. Interestingly, birds are also affected. They have quite a unique respiratory tract, so they're really susceptible to essential oils that might be in the air, for example. And clinical signs will depend on the route of administration and develop within minutes to hours. So ingestion or absorption through the skin can lead to things like vomiting, lethargy, drooling, ataxia, anorexia, and more serious complications include tremors, hypotension, GI ulcers, bradycardia, seizures, liver and kidney failure, and rear limb paralysis. And so if essential oils are inhaled, symptoms can include nausea, drooling, vomiting, shortness of breath, coughing and wheezing, production of tears, and like a watery nasal discharge as well. And some essential oils are actually hepatotoxic, so it can cause liver damage. And these include things like tea tree and cinnamon bark, and others like eucalyptus, sage, and cedar can also cause seizures.
This could be a problem, can't it? Because there's a lot of natural, in inverted commas, cleaning products now, which try and remove a lot of the harsh detergents and have replaced it with nice smelling orange oil and things like that. And actually, some of it can be quite poisonous to some of our pets.
And treatments for this include supportive care, such as fluid therapy. You can give certain drugs to protect the liver, such as N-acetylcysteine. Anticonvulsants can be given if seizures are present, and things like oxygen, steroids, and bronchodilators as well. And something else that can affect cats in a similar way is paracetamol. So as we talked about with essential oils, cats lack glucuronide transferase, which is needed to metabolize like phenol compounds, but is also needed to help metabolize paracetamol. And you can then get accumulation of toxic intermediates. And this can lead to a methemoglobinemia and hepatotoxicity in cats as well.
The paracetamol toxicity, the same mechanism as the essential oils.
Yeah.
I think that human drugs causing poisonings is quite a big chunk of it, actually, isn't it? You mentioned paracetamol, which obviously quite prevalent in most people's houses. I've also come across quite a few stories of pets being poisoned by illicit drugs. So particularly dogs eating discarded ends of cannabis joints and then getting stoned. Certainly come across that more than once.
So the final poison I want to talk about today is lilies. What's interesting about lilies is that only certain lilies or true lilies are toxic. So these are lilies within the Lilium and Hemerocallis families. And these are nephrotoxic to cats, so can cause damage to renal tubular epithelial cells, which can result in an acute renal failure if left untreated. Signs can normally begin within 1 to 3 hours after ingestion and include salivation, anorexia, lethargy, and vomiting. And then over 12 to 30 hours, dehydration can develop along with polyuria, continued vomiting and lethargy, weakness, and death normally occurs within 3 to 7 days after ingestion. And again, treatments are quite generic for this. So it includes decontamination, monitoring of renal function, and IV fluid therapy as well.
And how do cats normally get exposed? Is this through people having lilies?
I think so.
In the house?
Yeah.
Yeah. Quite a few things on there I think that have surprised me, actually, as things that we often have in and about our house that can actually be harmful to our pets.
Yeah, the list was really long when I was looking at common household poisons that are toxic to a lot of pets. There are some things on that list that are also poisonous to humans if ingested, like weed killers and things like that. But
of course, yeah, that makes sense, doesn't it?
These were quite common ones that not everyone necessarily thinks about.
I was surprised. I did do a bit of research for this episode, I promise. I was surprised to learn that there is actually a pet poisons information service similar to the human one.
Yes, there is.
Which I had no idea existed. But clearly, I think pet poisonings happen probably fairly often and typically, I think, are probably managed symptomatically rather than developing into sort of severe cases that do require extensive treatment. Is there a market for a pet toxicology service? That is the question that has been flying around my mind.
I don't know. I guess a lot of, especially with these, there's going to be evidence of them having ingested or come into contact with something that might be toxic, like empty chocolate wrappers, for example, mince pies scattered over the kitchen floor, things like that.
Yeah, there's usually some history, isn't there? So I guess identifying poisoning in these cases is done through circumstantial evidence rather than needing to necessarily test for particular compounds. So quite a lot to take in this week. Quite a lot of take-home messages, making sure that you keep your chocolate away from your dogs and keep your raisins away from your dogs and keep your onions away from your cats, which is a new one to me. The cats often eat onions. I can't imagine they seek them out. I can't imagine
they do.
No.
But you get things like onion powders and things that are more concentrated.
Okay.
So there is more of a risk with those than with fresh onions.
So basically, in conclusion, be aware of what's around your pets, because some things could be poisonous to them that aren't poisonous to us. So I think we're going to wrap it up here. I hope you've enjoyed listening this week. Do give us a like and follow on social media.
You can find us on Instagram at _tox_lab. We also have a page on LinkedIn. And if you want to give us any feedback about any of our episodes or have any suggestions for future ones and don't use social media, you can email us at thetoxlab@gmail.com. Hope you all have an amazing week and we'll see you next time. Bye!